Do you wake up feeling tired and fatigued? Do you toss and turn at night, wake up gasping and snoring? If you said yes to any of these questions, you may have a condition called obstructive sleep apnea. According to the American Sleep Apnea Association, it is estimated that more than 22 million Americans suffer from obstructive sleep apnea. 80% of those cases are moderate to severe and are undiagnosed. To put that in perspective, that is approximately 7% of the American population. Today I'm going to inform you on what obstructive sleep apnea is and 3 different treatment options used to resolve the disease. The 3 treatment options I'm going to discuss are positional therapy, oral appliances, and continuous positive airway pressure, or CPAP. Along with being a registered respiratory therapist, I'm also a registered sleep technologist and have performed all aspects of sleep testing. Before I discuss the treatment options, let me talk to you about what obstructive sleep apnea is. According to the Mayo Clinic, obstructive sleep apnea is a type of apnea that occurs when your throat muscles intermittently relax and block your airway. As you can see in the diagram on the left, this is a non-obstructive airway versus an obstructive airway on the right. Symptoms of OSA include excessive daytime sleepiness, loud snoring, abrupt awakenings accompanied by gasping or choking, dry mouth, morning headaches, and difficulty concentrating during the day. If OSA is untreated, it can lead to more serious conditions like high blood pressure, stroke, diabetes, depression, and in severe cases, death. So now that we've talked about what obstructive sleep apnea is, it's now time to talk about the therapies. The first therapy will be positional therapy. According to sleepeducation.org, positional therapy is a behavioral strategy to treat positional sleep apnea while the patient is sleeping on their back. A position belt can be utilized to avoid sleeping on the back. This belt is worn around the waist and has a pack along your back. When you attempt to turn to your back, the pack blocks that and has you turn back to your side or lateral position. The next treatment we'll talk about are oral appliances. According to Harvard Health, oral devices are designed to position the lower jaw slightly forward and back to open the airway. These devices are custom fit by a dentist to help prevent the soft tissue from blocking the airway during an apneic event. As you can see, the oral appliance in place is pulling the lower jaw up and forward, allowing the airway to be open and free. In a case study performed by Marie Markland, PhD with Department of Odontology at Yuma University, she found that oral appliances reduce obstructive sleep apnea and snoring and have positive effects on daytime sleepiness and quality of life among patients with mild to moderate sleep apnea. The last therapy that we're going to talk about is continuous positive airway pressure, or CPAP. CPAP machines gently blow filtered air through the airway at a constant pressure to keep the tissue from collapsing. CPAP machines are very basic and easy to use and are composed of 3 major components. The diagram shows a patient wearing sleep apnea, and as you can see, the positive pressure is blowing the airway open and not allowing the tongue and soft tissue to fall back and block the airway. The first component of the CPAP therapy is called the CPAP motor. The CPAP motor is there on your left, and it draws in room air through a replaceable filter and puts it out at a set pressure. The air is sent into the CPAP hose at the prescribed pressure by the physician. The CPAP hose is here on the right, and it's just a connective tubing that's 6 foot long that connects the CPAP motor to the CPAP mask. The next diagram we'll show you is of the different CPAP masks. Obviously, they come in a wide variety of sizes and shapes, and there's 3 different styles. The first style is on the left, which is a full face mask that covers the nose and the mouth. The second is a nasal mask that just covers the nose. And the third is a nasal pillow that just seals on the outside of the nostril. It's a personal choice of the patient as to which mask works best for them. According to the American Sleep Apnea Association, approximately 50% of all patients diagnosed with sleep apnea and prescribed CPAP therapy will abandon the treatment or fail the therapy. Although CPAP is the gold standard treatment for sleep apnea, it is important to follow up with a board-certified sleep physician to make sure that you comply with your therapy. I was diagnosed with sleep apnea about 10 years ago and chose CPAP therapy. Using the therapy made a dramatic impact in my life. So in conclusion, we have discussed obstructive sleep apnea and 3 different treatment options for it. So if you think there's a possibility you or a loved one has obstructive sleep apnea, there is hope for a better quality of life. The closure of the upper airway and snoring caused by sleep apnea is very frightening to watch and comes with a long list of health concerns. Luckily, there are 3 good therapy options to treat this epidemic: positional therapy with a sleep belt, oral appliances, and CPAP therapy. I hope you learned more about sleep apnea today, the indications for use of treatments for the disease. Thank you very much.